At ONsalus Health, we explain the 6 main causes of a painful lump under the arm. Feeling a lump or swelling under the armpit can cause concern, especially if it's painful. This condition often appears due to swollen glands, the product of bacterial, viral or fungal infections. Lumps in the armpit area can manifest for various reasons, and we explain which are the most common. Furunculosis. Furunculosis is a dermatological infection of the hair follicle produced by the Staphylococcus aureus bacterium. These types of infections are deep and develop through the dermis layer. The lumps they cause are very painful and solid. The inflammation increases in size over days, which can rupture and generate pus. How to treat furunculosis? We need medical evaluation to determine if the lump should be drained through an incision. The treatment will depend on each case. Some require oral or topical antibiotics. Chronic furunculosis requires more complex treatments focused on specific antibiotics and decontamination related to the patient's environment. Swollen lymph nodes. Swollen glands also manifest as lumps or bumps under the armpits. They appear due to infections present in the body, specifically in the arm and breast, or as a result of mononucleosis, herpes, AIDS, lymphoma, and many other diseases. The nodes usually increase in size to fight infectious agents. How to treat swollen lymph nodes? The swollen node usually disappears on its own within days. If it does not, it's important to see a doctor if the inflammation persists, especially with fever and discomfort. By trying to determine the cause, the appropriate treatment can be administered or more tests can be scheduled. You can learn about another reason for armpit lumps with the video we share above on an ingrown hair removal. Hydrogenitis suppurativa. Also known as acne inversa, they are hard lumps that form in the armpit area when the sweat glands become inflamed and block sweat secretion. Hydrogenitis manifests as nodules or small painful lumps, which leave marks or scars on the skin. How to treat hydrogenitis suppurativa? It requires a prior medical evaluation to see how advanced is the disease. In general, corticosteroid injections and the use of oral and topical antibiotics are suggested. In more serious situations, surgery is indicated to radically remove the affected area. Lipomas. Lipomas are benign fatty tumours which usually appear in subcutaneous tissues and deep soft tissues. Their growth is regular and slow, producing rounded lumps with a cystic texture. In general, these fatty lumps are asymptomatic, so a person can have one for a long time and not manifest pain. How to treat lipomas? Lipomas are usually harmless and do not need treatment. Sometimes their large size and discomfort means surgical removal or liposuction are recommended. If this video is helping to solve any doubts, consider providing a super thanks to help grow the channel. Breast infection. Also known as mastitis, breast inflammation causes lumps under the armpit due to an infection of the breast tissue. This is often related to an infection in the lymphatic glands. It is most common in women who are lactating. How to treat breast infection? These infections are frequently treated with specific antibiotics and rest. Follow guidelines recommended by the specialist. Lymphoma. Lymphoma is a type of cancer that occurs in the lymph nodes. It manifests with an increase in size and can be seen and palpated in the inner part of the armpit. The person will usually also have fever, sweating, and weight loss. It requires a medical evaluation to determine an accurate diagnosis and apply the appropriate treatment. How to treat lymphoma? In most cases, this pathology is treated with chemotherapy and additional radiotherapy. These are the main reasons why a lump may appear in the armpit, but there are others. If you want to continue learning about other ailments, don't miss the playlist we share here. Leave us a like and share any questions in the comments below. We'll see you next time.